Hello, my name is Maya-Itzel, and the topic that I chose to research this semester are social barriers facing individuals diagnosed with the autism spectrum disorder. The topics I'd like to discuss are financial challenges in the family, educational challenges, transitional age youth and their economic challenges, as well as resources available to both the family and transitional age youth. According to the Center of Disease Control and Prevention, 1 in 150 children were diagnosed with autism spectrum disorder, also known as ASD, in 2000. In 2016, 1 in 54 children were diagnosed with ASD. As the number of children diagnosed with ASD goes up, the resources available are not meeting the needs of their families. Government funding towards programs for youth and families with a loved one diagnosed with ASD is not reaching or being directed to the families in need of more resources. ASD is a developmental disability which affects communication and behavior. The reason why this disorder is known as ASD is because there's a wide range of symptoms associated with it. This may include social interactions, daily behaviors, a person's interests, and activities which they are willing to participate in. As a child, families of someone diagnosed with ASD financially support them. This includes schooling, activities, learning equipment, and healthcare. Depending on where a child is on the spectrum, they may require more continuous care and stimulation. This can leave parents unable to work and forced to be home with their child. Childcare can also be expensive, especially for a child with ASD. If there's a two-parent family system, this can often leave a family reliant on one income to support all costs. Healthcare can also be expensive for a family. Many insurance plans refuse to cover therapy, which children with ASD oftentimes need several times a week. This therefore forces a family to pay approximately $150 out of pocket per session, which adds up to about several $100s a week. This can continue into a transitional age youth's life, as a family does need to support them. The difference between public schools and private schools usually is that private schools are able to support a child in a family with dealing with ASD much more. They often support with aides, tutors, and more technology, more resources that public schools usually cannot afford to do. Resources that are not covered by public education could be technology. Technology can be very expensive for public schools to be able to afford. This usually is an out-of-pocket expense of several $100s to several $1,000s for a family not going through a private school. Education beyond high school usually is supported much more by private schools, as they're able to support the child with counselors and aides that are able to help them apply and support them through the process of getting into a higher education. 58% of individuals with autism work in their early 20s. Ac- Depending on an individual's position on the autism spectrum, they may require a higher level of care and support. One of these supports could be a aide on site at a job. Frequently, employers do not hire people with ASD, and if they are interested in hiring, they rarely are interested in accommodating the daily support such as an aide on site. The jobs that are willing to hire people with ASD usually do not pay enough for them to be able to financially support themselves. According to the Interactive Autism Network, most transitional aged youth diagnosed with autism fall below the federal poverty line. Usually this was due to them working a part-time and minimum wage job. As a result, most young adults with autism were not financially able to support themselves and be more independent. Medicaid is a state-funded program that offers care and services to families in need. In order to qualify for such resources, this program requires that families have a very limited income as well as very limited resources. The amount of resources available also depends on the child's age. As they grow older, usually the resources continue to decline. Social skills workshops were designed to provide resources and teachings on basic life skills post high school. Usually, this meant that they were going to be covering materials such as daily interactions in class, as well as social interactions outside of class, and going to the store, doing basic things that they may need to do outside of school. What wasn't covered was college applications, moving on to a higher education, as well as job applications, interviews, and how to deal with daily tasks in a job. That way, they would be able to financially support themselves much more. Usually, these workshops were much shorter and they didn't last very long in their high school time. If the content of the if the content and the length of the workshops were increased, this would support the individuals much more. Without the necessary resources and supports being provided to transitional aged youth who are diagnosed with ASD, the likelihood of them becoming independent adults who are able to support themselves is unlikely due to systemic discrimination in the workforce, healthcare, and education systems. There needs to be far more resources available to people diagnosed with ASD, such as more job opportunities, employment practices, life skills, and educational opportunities. If a program were designed that was free to individuals and families to be able to support a child with ASD, there would be far more transitional aged youth diagnosed with ASD that were able to be more independent and financially support themselves. This number of children diagnosed with ASD being able to become more independent would increase. Thank you.